Hello, Kowatsi Kaita Wahapa, Dushiname Halkawak. Hello everyone, my name is Brandon Pasquale. I'm a peer support specialist with the Pueblo of Acoma Behavioral Health Services. So I want to put it out there that this video is about me. So there's a self-disclosure as far as myself sharing a story in my situation. So in the past video I shot with my son, or that we filmed together, I had mentioned the comment, there's no fear in asking for help. And so I would like to elaborate on what it is or what I meant when I said that. And so, again, the self disclosure of this video is some of you may know that I worked in the EMS field, public safety for back in the day. And so there was it was over my time when I was working the EMS and fire that I had a situation where my partner and I were involved with a weapon. The situation, the outcome was that everyone was safe. We survived. We went through. We came out. But the situation was, when you come that close to fighting for your life and the lives of others, it changes you. You don't see it at that time. You don't see it at that moment. A lot of us have different stress or situations in our life that create trauma for us. And I like to share a little bit that even us as Native people, we suffer from a lot of trauma. Historical trauma, generational trauma, even trauma within our homes, our families, situations that may put us at a high stress level, and we don't realize it at the time what it does to us. So how did that situation change me? Well, it changed me without really seeing that I became hypervigilant, that I was easily agitated, that you eventually would experience night sweats, night terrors, that's what they would call them. And so you don't speak of it until after a while. You can speak of it more. You can speak of it more easily. And so I say that because that's what I'm talking about today. And in the past, I couldn't even talk about it. So it wasn't until someone told me that I may be suffering from post-traumatic stress. It wasn't until then that I was able to get some help. And so when I share with you about there's no fear in asking for help, I put that out there because if you think of it, you survived the situation, you weathered the storm, and you have the courage to change. You have the courage to ask for help because you were courageous already in the moment of that situation. And so why does it become so difficult to ask for help? Well, because things change with us mentally, emotionally, and when you come so close to being pushed to your boundaries, you change, and something or someone takes that away from you to make you feel vulnerable. And so when we feel vulnerable, it can be scary at times. So again, no fear in asking for help. It's just you have to ask for help. You have the courage. You have the strength. Like I said, you weathered the storm. And you may be experiencing various things from a trauma-related or highly induced stress situation. And so I offer these words of encouragement, but I also offer that you would look to your employee assistance program. They offer sometimes some counseling sessions for free, and that may eventually get you in to the door for extended services with another program or even with our program. I don't know what ABE has in place for their employees, and I reach a vast amount of people. I've seen that these videos go out many places. There's NMCAL, that's the New Mexico Crisis and Access Line, suicide prevention, and there's various, maybe in your local community there's areas in which you can reach out to for help. I know Medicaid covers some of the areas in grants. There is mental health, behavioral health facilities, clinics that help, veterans, VA. And so if you're able to ask and go and seek those services, by all means, please do so. Everyone's faced with situations in their lives, but the change is for yourself, but your families may see the benefits of your change. So with that, I share with you, if you want to reach out to myself or anyone at our program, again, Acoma Behavioral Health Services, 505-552-6661. Again, by all means, I look forward to hearing and seeing from everyone when this whole COVID crisis pandemic goes away. So thank you very much.